This is an interesting case. A 69-year-old lady on dialysis had back pain radiating to her neck, worse with movement. Onset is suddenly 1 hour prior to emergency room visit while she was sitting watching TV. She also complained of diarrhea, nausea, and numbness in her feet. No chest pain. There is transient arm numbness. Because of such history, the emergency room doctor ordered a raw PE, but due to patient's renal failure, cannot give contrast, so this non-contrast CT was given. What I'm trying to show is a difficult diagnosis. For example, here, if you look carefully, there is a hyperdense region in the spinal canal in the ventral aspect, which smooths out in the lower part, likely in the epidural space, extending all the way up. It's hard to tell because of you have the window of that, but on sagittal, you can clearly see a line of dense material versus less dense material. Posterior to the bone, you can see the bone that demonstrates diffuse fusion. This you can see here's a layering of the epidural lesion. That is a epidural hematoma. However, this epidural hematoma was not reported due to the we did not look carefully in that region. 3 days later, patient had MRI. Due to clinical suspicion of spinal cord compression. By this time, the hematoma has retracted to this size, only to a lobulated region in the thoracic spine with a black rim of hemosiderin. Most of the other epidural hematoma has resolved and retracted. There is a spinal cord compression due to the hematoma. Here's a black area. The cord is being compressed. The cord normally should have gray signal, now has some white signal because of the venous congestion secondary to compression by this black and no white colored epidural hematoma. This is the hematoma. The cord is kind of a moon-shaped, crescentic shaped, and now the cord demonstrates normal morphology. So epidural hematoma compressing on the cord. I happened to see the patient back in a year later. The epidural hematoma is resolved. There is no more spinal cord compression. I don't see much of a permanent damage of the spinal cord. So unlucky that there's no permanent injury. Let's compare one more time. This is normal for this patient. Epidural hematoma with spinal cord compression with abnormal cord signal. Normal cord signal gray, abnormal white, and this is spinal cord. This is normal. So for back pain and a dialysis patient, I guess we'll have to think about epidural hematoma spontaneously occurring, maybe because of coagulation problem from the renal failure or dialysis. So just learn a case.